Hi and a very good evening all of you. So today what we're going to do is we're going to start a new series of clinical question discussion. What I mean here is besides the theory lecture which you have on your app, we're going to start another series of lectures which we're going to discuss clinical questions, especially when it comes to the medical subjects. Okay, definitely the clinical subjects also, but medical, you will say that this is the most difficult one, isn't it? Because you don't have the exposure to it. Now, why so? Why are we doing this? If you just open your general medicine questions in the last 5 years, you open your general pathology questions in the last 5 years, you will see a common thing. There's a lot of clinical questions. Lot of clinical questions out there. Some of them are very easy, very easily you can do it, but provided you know how to find out the keywords. Okay, that is very, very, very significant. So if you know how to find out the keywords, then it becomes very easy. Now there are some questions which goes beyond that. You might have to exclude the options. You might have to know a little bit more in detail, something new concept. So everything we'll include in this. Every day we'll be discussing one topic. Sometimes one topic might go more than 1 day. So let us begin without more introduction to this. Okay, so what I'm going to give you here is, I'm going to give you questions, related questions to differentiate between, or how to differentiate between the key points. Okay, I'm going to discuss the topic in detail. And also I'll be discussing why we didn't select other options, okay, and a little bit on background information. Sometimes the background information will come early, sometimes the background information will come in the late, because at times you might be knowing the concept, so just a review will be there, but at times you don't know anything about it. We'll go for the background information first. Okay, so let us just go directly into the question part. So also I'll be discussing the key points. Okay, here I'm going to give you 3 questions. Okay, 3 questions very much related. Okay, so let us see one by one. You can see here this is the options out there. Okay, and there's a question, same the second question, all the 3 are related. You're going to differentiate between the 3. Okay, now first question, a 56-year-old woman complains of loose stools, noticed since 3 months, with stomach pain and mild bloating. So you know the topic is going to be GIT and liver. Okay, so with stomach pain, mild discomfort, stools are pale in color. You might have seen similar question in your previous year's papers, but yes, I'm going to give you different types of it. Okay, so it's here. So stools are pale in color. No abnormality was noticed in bilirubin or protein level. The most probable diagnosis is. So I want you to pause the point. I'm going to discuss the key points as well. Okay, what actually comes, or like you arrive at an answer based on what key points. See, basically my purpose is not just to give you some questions, or not just to teach you some concept. I want to teach you the way or the methodology to answer this kind of questions. By the time we finish the entire series, okay, of all the questions, you will understand, okay, this is how I'm going to attempt a particular paper. So you come across that, you practice it on the app, and you come across it again and again, this type of questions, finally you'll say, okay, clinical question is not a problem for me. Okay, otherwise every time this comes, you become worried about it. So I want you to pause this video, whether you're watching it on YouTube or on the app. Pause this, read this question, read this option, amylase deficiency. So that they're asking the diagnosis, hemolytic jaundice, bile absorption, trypsin deficiency. So what is the answer for that? Pause it, comment it below right now. Okay, pause it, and if you know, comment it. If you don't know, wait, I'm going to give you the key points to arrive at an answer. After that, pause it and answer it. Anyway, you have to try to answer it, no matter it's wrong or correct, because I want first you to analyze your base information or your base level. Where are you right now? And how you're going to improve, how much you're going to improve as we go on. Okay, that gives you a lot of confidence. Okay, if you say that I will answer only when I know everything is perfect, then you don't know how good you have performed. Then that will not build your confidence. Okay, so pause the video, answer it if you have some idea about it. Let it be wrong. Okay, now once you know the key points, to answer it, again you can attempt it once again. I'll be analyzing your answer, whether it's on YouTube or on the app. In the app there is an option, in the comments option there below the video. So whether it's on the app or on the YouTube, comment it, I'll be analyzing it. Another thing, if you have any doubts, comment it below. Okay, I'll be having another video to discuss. In fact, I wanted this to be a live session, but you know, most of your interns, it's not practical to conduct live sessions for you every day. Your availability is a big problem. So what I thought is, you comment it below, I'll be analyzing it. If any doubt, clarification, anything needed, I'll come with another video. Okay, and I'll be analyzing it. I'll be telling you how to improve on that. Okay, now, so that's one question. Now there's another question. A 56-year-old woman, same thing, same way, complaints of loose stools, noticed since 3 months again, with stomach pain and mild discomfort. Here it was mild bloating, so that's one difference out there. Stools are pale in color again, raised bilirubin but no abnormality in protein level. So protein level is normal here, the most probable diagnosis. Now the third question. Okay, a 56-year-old woman complains of loose stools. Again, you can pause it here and try to answer it. Question number 2. Now here, a 56-year-old woman complains of loose stools, noticed since 3 months, and stomach pain, everything the same, and mild discomfort. There is no bloating again. Stools are normal in color now. The stool's color, it was pale here, it is normal here now. Bilirubin levels were raised here also, so that's another difference. And haptoglobin, the protein level was normal in question number 2. Here the haptoglobin levels in the blood decreased. Yellowish discoloration of the skin was also noticed. So basically here also, that the question number 2 also, there was a possibility there. So discoloration of skin was also noticed, the most probable diagnosis. So now let's see, if you have not answered it yet, if you didn't get it yet, I'm going to give you the key points now. Okay, just okay here. In this particular question, the key points are, you have to identify it. No matter now you are not able to do it, it's fine. Okay, you have to identify the key points here. Here the key points were loose and pale stools. That is diarrhea and pale stools. Okay. In the second key point was, you'll see that normal bilirubin. Okay, the bilirubin, no abnormality. Okay, there is bilirubin is no abnormality. You see there. Okay, there is no abnormality in the urine and there is a bloating there. Okay, bloating was a feature you can see there. Okay, bloating is there. So this was the key points there. Any idea you're getting? No problem. Okay, no idea, no problem. Now let's differentiate what are the key points in this particular question. Okay, that is, there is raised bilirubin in the both this as well as this. We'll see that. Okay, oh my god. Okay, fine. There is raised bilirubin in this question. Both of this, there is raised bilirubin. Unlike the first one, there is no raised bilirubin. You just pause the question and read it if you want. Okay. Now, both of them, here there is loose pale stools. Okay, the second one, loose pale stools, normal colored stools. The third one. Okay, this is the stools are, okay, this is it. The stools are normal in color. Okay, I'm just going slow so that you understand it. Okay, then, yeah, this is one key feature. Here the protein level was normal in one also there is protein level was normal. Here the protein level is low, in fact low haptoglobin level. Okay, so how to answer this? Okay, in the first we said there is bilirubin is normal, means it is not jaundice. Okay, in the second 2, okay, there is raised bilirubin. There is raised to bilirubin. So these 2 are basically jaundice. This is not jaundice. The first question is not jaundice because normal bilirubin. But there's some problem with digestive system which caused loose pale stools with blotting. Again, digestion problem. Okay. So now let's come to the options. Amylase deficiency. Hemolytic jaundice excluded right now. That's not jaundice because bilirubin is normal. I'm going to come to the description, don't worry. Okay, details and all. Bile acid malabsorption, let's keep there. Let's see trypsin deficiency and amylase deficiency. No, definitely the answer for this is bile acid malabsorption. I'll come to that. Amylase deficiency and trypsin deficiency. The thing is, amylase is an enzyme to digest carbohydrates. Trypsin is an enzyme to digest proteins. Okay, so please note both of them have no role in changing the color of the stools. Whereas bile acids can change the color of the stools. Okay, I'll come to the details of that. So here, only reason why the stool color became pale is because of bile acid malabsorption. Okay. Now, if you go to this, the second and third, both of them have one thing in common. Raised bilirubin means it's jaundice. It's not bile acid malabsorption. Okay, it's the jaundice. Both of them are jaundice. Now, you can see there loose pale stools in one, normal colored stools in the second one. So here there is a difference. Okay, another difference is the first one there is normal protein level, here there is haptoglobin levels are low. Haptoglobin should give you a clue right away. Hemoglobin, haptoglobin, hemolytic jaundice. I'll come to the details what is the role of haptoglobin, but basically here the haptoglobin levels are low, directly gives you the clue that it's a hemolytic jaundice. Okay, now here it's a loose pale stool. So let's come to one by one. Okay, discussing one by one. Hopefully you have got this particular question. Okay, loose pale stools, the question number 1. Okay, I'm going to come to the questions now. Hope you have paused the video and understood the difference in the questions if you have any confusion, because then only you'll understand this better. Now, loose and pale stools, you have to understand here, or you call it as pale or clay colored stools. Please note, it's also seen in obstructive jaundice. So, two conditions now you have to remember. Pale loose stools, I'll tell you why this pale loose stools are seen, but please note two conditions. One is bile acid malabsorption, which is this particular answer for this question. The second is obstructive jaundice, not in any other jaundice. Okay, but the difference which is going to make is in obstructive jaundice you have increased bilirubin. Here there is no increased bilirubin. So the answer is definitely then bile acid malabsorption. Okay, and here the option is again hemolytic jaundice, so there is no confusion at all. But the best way is there is no bilirubin level change, so there is no confusion. Okay, now they say that it's bilirubin deficiency normal, so bilirubin is abnormal only in jaundice. Okay, bloating is not seen in jaundice. Please note, again this is clear, but very clear, it's not a jaundice because there is bilirubin is normal. Okay, now if you come to the second question, so there the answer is very clear. I'll come to more about bile acid malabsorption in the end. Okay, why exactly, how exactly, everything. Now, first I want you to understand how it gets differentiated. Now the second question, the key points were both of them raised bilirubin. So definitely it is jaundice. Okay, now loose pale colored stools. Okay, we said if it's pale stools, it is definitely not going to be hepatocellular or hemolytic. It is, I told you, obstructive. Pale stools are seen only in obstructive jaundice. It's not seen in hemolytic or hepatocellular. Okay, so if it is loose pale colored stools, in this case with jaundice, okay, with raised bilirubin, the answer here is going to be, okay, I'm sorry, the option has to be corrected. It is obstructive. Okay, obstructive jaundice. Okay, the answer has to be obstructive jaundice here because it's a jaundice, but loose pale stools which is not seen in hepatocellular or hemolytic. Okay, now coming to the third question. Okay, that is, okay, let's bring this down a little. Where again we have raised bilirubin, so it's a jaundice. Okay, raised bilirubin, it's a jaundice. Okay. Normal colored stools. So what can be normal colored stools other than obstructive? That is hepatocellular or hemolytic. Now I told you low haptoglobin levels can be seen only in hemolytic. Okay, this is how you differentiate between the three. Okay, if you have any confusion, repeat the video. It's simple. Is your jaundice or not? Is your bilirubin levels raised or not? If raised, it is jaundice. If it's not raised, it's not jaundice. Then the possibility is very simple. Identify other options. Trypsin amylase, there is no change in color of stools. Only option correct is malabsorption. Okay, then if bilirubin is raised, see the color of the stools, pale colored, obstructive. If normal, hemolytic or hepatocellular. So to differentiate between hemolytic and hepatocellular, you have the low haptoglobin levels. Okay, now I want to just give you the concept behind low haptoglobin levels here. Okay, low haptoglobin levels, the reason for this is it's basically seen in hemolytic jaundice. So hemolytic jaundice means what? Now hemolytic jaundice, basically lots of hemolysis, breaking down of RBCs take place. Okay, and you get free hemoglobin because see, hemoglobin is inside the RBC. So RBC broken, hemoglobin is released. Free hemoglobin is very toxic. Okay, very toxic. So there is a protein called haptoglobin. What it does is it detoxifies. Hemoglobin levels is normal. Okay, wait, before that, the role of haptoglobin. What it does is it detoxifies the hemoglobin in the blood. Okay, hemoglobin as such, free hemoglobin is toxic. If it is inside the RBC, no problem. Free is problematic. It can cause renal failure, all those problems. So detoxification is by haptoglobin. So you have, imagine 10 molecules or 100 molecules of haptoglobin. Loads of free hemoglobin comes. What it does? It detoxifies. What happens to this free haptoglobin? Comes down. Isn't it? All the haptoglobin which was free is now binding with a free hemoglobin to detoxify. So the level of haptoglobin comes down. Got it? So haptoglobin level is normal in other types of jaundice because there is no free hemoglobin in other types of jaundice. How is this other types of jaundice? It is either hepatocellular, problem with liver, or obstructive, problem with the flow of the bilirubin. Okay, or the synthesis, that is hepatocellular synthesis. Now there's a separate lecture on your app regarding this jaundice. I'm not going into that. Okay, so basically if there is haptoglobin level increase, it is this type of, that is hemolytic jaundice. Okay, now you'll ask me a question. I told you two conditions where you can get pale colored stools. One is bile acid malabsorption. I'm going to come to that. Okay, what is bile acid and or malabsorption? Second is, I said, obstructive jaundice. Now why this color change? Now what gives the color or the brown color to the stool? It is the stercobilinogen or stercobilin. Okay, now if there is stercobilin, which is normally there, okay, in your stools, you get brown color. If it is not there, you get the pale color. Okay, so now what happens? You see, what happens is bilirubin in the intestine. Okay, you have liver. Okay, I'll just show you. So if you see here, bilirubin is produced in the liver. I'm not going into the metabolism. It's produced in the liver. It goes to the intestine. Okay, here bilirubin is split into stercobilinogen and urobilinogen. Okay, very simple. Now, so this is it. In bilirubin in the intestine, stercobilinogen and the urobilinogen. So, okay, it's fine. So it's went there. Okay, so basically this stercobilinogen gives brown color to the stool. So now imagine there is obstruction of this flow here, a flow of bilirubin into the intestine. Will the bilirubin come here? No. Will stercobilinogen form? No. Will the stool be brown in color? No. Then what will be the color? Pale. So in obstructive jaundice, you have the stercobilinogen is absent, you get pale. Okay, because this flow is obstructed. In hepatocellular, there is no such problem. It comes, whatever bilirubin is formed, though the bilirubin is less, whatever bilirubin is formed, it comes to the intestine and you get stercobilinogen. So you don't have the problem of it is decreased, definitely. Stercobilinogen is decreased, but it will not be to the level it becomes pale. It will be in between hemolytic and in the middle, that is not very significant. At times it will be a little pale, but not always. Okay. Whereas hemolytic, no problem at all. There is lots of bilirubin formed. All the bilirubin comes to intestine, stercobilinogen formed, definitely the normal color will be there, brown colored stools. So in obstructive jaundice, You have stercobilinogen absent, you get pale colored stools. Whereas all other has got stercobilinogen, so you get brown stools. Okay, so urobilinogen is the second compound which produces or goes or excreted through the urine, which produces a pale yellow color. Okay, now so that is, you go, if you want more details, there is a lecture on GIT. Okay, it is there, you can go through that. So basically, you know two things now: pale colored stools, bile acid malabsorption, and the the obstructive jaundice. Okay, now next what I want to tell you is, so hope you understood, got some idea. It's very simple. Now other options, we said there are two other options there. One is amylase deficiency and trypsin deficiency. So basically some key points here. Amylase is important in carbohydrate metabolism. And if it is deficient, you get abdominal discomfort, bloating, everything is seen, but you can't see pale stools. Okay, you will not see pale stools, you will not see bilirubin raised. Okay, which is the features of the questions out there. Trypsin deficiency, like I told you, again, an enzyme in protein metabolism. This was in carbohydrate, this was protein breakdown. So if protein breakdown is not taking place, you don't get amino acid, you don't get protein in the body. So there will be low proteins in the blood, okay, which we saw, but not haptoglobin, please note. Haptoglobin specific for binding with hemoglobin. So due to impaired metabolism of proteins, there will be in general protein deficiency, not specifically haptoglobin. So now see, in this question, if I can twist it, normal colored stools, all those problems, okay, pain, discomfort, normal colored stools, normal bilirubin, protein deficiency, then it is trypsin. Okay, where the bilirubin is normal, there is no change in color of stools, then it's trypsin deficiency, because in trypsin deficiency you have low protein, you have the problems of abdominal discomfort, but you don't have what you call, like, there's no loose or pale stools, no raised bilirubin. So it can be even twisted in this way also. Okay. Now finally, I want to teach you something that is about your malabsorption. Okay, understanding the bile acid malabsorption. Some people want to know this also. Okay, you're happy that there is discomfort, there is pale stools, okay, there is normal bilirubin bile acid malabsorption, but why all this? Let's see. So what you can see is, in bile acid metabolism, bile is produced in the liver. So you have the bile here, okay, then it is going into the gallbladder for storage. So storage in the gallbladder, okay, so because where exactly the malabsorption problem happens, that you have to understand. Okay, so this is the storage in the gallbladder. From there it is released into the small intestine. So it's released into the small intestine. Here the digestion of fat happens. Please note, bile acids are important in the digestion of fat. Okay, now from there it goes into the large intestine, okay, bile acid, and from there it is where absorbed into the bloodstream. Now the problem is here. Bile acid malabsorption means the problem is here. This reabsorption doesn't take place. Now what happens? Normally what should happen is, it should reabsorb into it and recycled into the liver through what we call it as hepatobiliary circulation. I've explained this in many lectures, I'm not repeating it. Hepatobiliary circulation. So it just goes back in fat. Okay, so basically the problem is here, means the bile acids are excreted. Okay, bile acids are excreted. Now, if bile acids are excreted, you get this pale yellow color. If too much of bile acids in the stools, you get the pale yellow color. Okay, otherwise normally it is absorbed, there is no problem. Okay, so that is basically the concept behind it. Now, what happens in malabsorption? We studied there is malabsorption. So basically the cause is GIT disorders. Okay, anywhere malabsorption problematic can happen. Okay, now the pathophysiology behind this problem is basically impaired digestion, because it's important in fat digestion, I told you. Now what are the features you're going to see if there is malabsorption? chronic diarrhea. Okay, the bile acids are released, you get diarrhea. Okay, I'll tell you if you want to know more, I'll tell you more. Abdominal pain because digestion is not taking place. Pain will be there. Bloating will be there. Okay, again digestion problem. Pale stools, I told you, this was the key feature. Due to excess bile acids in the stools, it gives that pale yellow color. Okay, now if you want to know why diarrhea is a very important feature, because the unabsorbed bile acids, we said there is no absorption taking place. Okay, there is unabsorbed bile acids here. Okay, so this unabsorbed bile acids act as osmotic laxative. Means it absorbs lots of water with it. It acts as a laxative, and due to osmosis, it absorbs lots of water. Whatever water is there here, it goes out as diarrhea, watery diarrhea. Okay, so that is the reason for diarrhea. Definitely pale stool. So these are the two very important features you have to know about it. Now, if you want to know more, an extra point, diagnosis, it's called CCAT test, or however you pronounce it. It's basically selenium homocholic acid taurine test. Okay, don't go into details of that. Okay, basically it analyzes how much bile is remaining. Okay, and that is the CCAT test or SheCAT test, whatever it is, just know the name. Treatment, basically you have two options. Either you go for a bile acid binder. Okay, you have lots of bile acid, and this bile acid is causing diarrhea, and diarrhea is the most dangerous problem. So you have something to bind with this excess bile acid so that there is no osmotic laxative effect. There is no water reabsorption, so there is no diarrhea. So that is one thing. Second thing, don't eat fat. So you don't have bile, don't eat fat. So there is no problem. Okay, very unfortunate situation. So bile acid binders, if you want to know the names of it, cholestyramine, okay, and this one, cholecalciferol. So basically this, what it does, simple, binds to the excess bile acids. So decreases the diarrhea. Okay, so there is no much to do there. So basically my purpose today was not to teach you malabsorption. My purpose for today was to make you understand the difference or make you understand the importance of identifying the key areas. Okay, again, if you want me to tell you, you have to see what are the key areas. Here in this question, what is the level of bilirubin? So actually this should come up. Okay, so is the bilirubin normal? What is the color of the stools? Okay, is there bloating? So bloating is, I would say, a very least important factor, because loose pale stools and this bilirubin will tell you what exactly the diagnosis is. If the bilirubin is raised, it's jaundice. If it's normal, it is not jaundice. Then it's loose pale stools, definitely this is bile acid malabsorption. Okay, if it's jaundice, look for the type of jaundice. Now this is a different lecture in itself, but I've just included here to give you a better understanding. So that's it. We'll come with some other topic the next day. Thank you so much.